Hello. The purpose of this video is to introduce approaches to engaging patients and their families in managing their transitions of care from hospital to home, as well as demonstrate methods to ensure patient understanding at discharge teaching and using the TeachBack method. Using the information from Module 6, I will incorporate 5 interventions that I've learned in the material. The interventions include encouraging family participation in care from the 6 steps to creating a culture of person and family engagement article. The second intervention is to use a caring tone of voice and attitude, comfortable body language, and if the patient is unable to do the TeachBack correctly, explain it again and recheck. This is from the TeachBack module at teachbacktraining.org. My third intervention is to discuss with the patient and family areas to prevent problems at home, such as highlighting the warning signs of the medical condition from the implementation handbook strategy number 4, ideal discharge planning. And my number 4 intervention is encourage patients to ask questions about care and inform them who to ask the questions from the patients and family as partners in care presentation. And the final intervention I will do is an assessment of the patient's perceptions of their ability to return home and actively engage in the discharge planning process. That's from the patient's perceptions of the quality of discharge teaching and readiness for discharge article. Okay. Hello?
Hello.
Hi. Hi, how are y'all today?
Good, how are you?
Good. I'm Leslie. I'm going to be your student nurse today. I'm working with Tim. I just need to double check and verify your date of birth and information for me, please.
My name is Alexander John Harrison, and I was born 2/1899.
Thank you, Alexander. And who do you have with you today?
This is my mother.
Okay,
Hi,
Mom.
I'm Gail.
You're Gail? Okay, nice to meet you. Is it okay if I do the teaching with you and your mom?
Yeah, that's fine.
Okay, great. How are you feeling? You ready to get out of the hospital?
Yes.
Okay, I bet you are. All right, well, we're just going to go over a couple things. I'm going to teach you how to use the EpiPen. Okay, because of your experience at the restaurant, we found out that you have an allergy to shellfish, right? Okay. Can you tell me a little bit about what happened at the restaurant?
Well, after I ate the shellfish, my throat started to close up and it became hard to breathe.
Okay. That is a very common symptom of a very severe allergic reaction. It's called anaphylaxis. Other symptoms might include your tongue swelling up, your lips swelling up, you might feel like tingliness, throat tighten, maybe your chest feels tight, and you have trouble breathing. Other things that might happen is you could get like hives or a rash, like an itchy rash on your body. Any of those signs are a reason for you to whip out your EpiPen, okay? So we'll want you to carry this EpiPen with you everywhere, okay? Ideally everywhere. However, it's very susceptible to extreme temperatures, so you don't want it to get really hot or really cold.
Okay.
So you definitely don't want to leave it in your car. Okay. Ideally, you want to have it on your person, especially when you go to a restaurant. So the important things to remember when you go to a restaurant is to let them know that you have an allergy to shellfish. Even if they prepare food in the same area where shellfish was made, it could cause a problem. That's why you always want to have it just in case. Okay. A couple things first. I know you already went through the doctor medical history and your medications. You don't currently take any medications, right?
No, I do not.
And as far as you know, you don't have any other allergies to medications or anything like that?
No allergies?
Okay. Other than the shellfish. Great. Do you take any other like vitamins or herbal supplements at home?
No, ma'am.
No? Okay. Do you have a history of high blood pressure?
No, I do not.
Diabetes?
Not that I know of.
Asthma?
No.
Okay. How about a history of depression?
No.
Okay. All right. Well, you actually have your information already, so you guys can kind of follow along with me. This is your patient information that you're going to take home with you.
Okay.
I'm going to kind of hit the highlights or hit the high points, but you will have this information with you when you go home. Okay? So first things first on the EpiPen, it contains epinephrine. Epinephrine is, your body actually makes it, but when you have an allergic reaction, you get an extra dose of the epinephrine to help counteract that allergic reaction that your body is having. Okay. When you inject it into your body, that epinephrine goes into your body and it will cause your heart rate to speed up, so you might feel your heart pounding out of your chest a little bit, that's pretty normal.
Okay.
You might get sweaty, you might get a headache, something like that. You might even feel a little anxiety, okay? So to use it, this is what it looks like. This is a trainer pen. The real one will have a little window and you'll actually be able to see the medication, but for training purposes, this is what we'll use, and you'll have this too to take home with you to practice more. So the orange part is where the needle comes out. The blue part is the safety. So when you're getting ready to use it, you start having those symptoms. You take the top off and you set it down, and then you hold it really firmly, and on the outer part of your thigh, halfway in the middle, you just jam it into your thigh, hold it for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you release. And the orange part will cover the needle.
Okay.
If for some reason you accidentally stick the needle into your fingers or your hand or somewhere else, you want to immediately seek medical attention. If you inject the epinephrine, it could cause problems anywhere other than right here in the middle outer part of your thigh. Okay? All right. So I am going to let you all try. And so I'm going to actually have you demonstrate it too, but we're going to let Alexander try it first, okay?
Okay.
So here's the pen.
All right.
All right. So tell me what you would do.
First thing, I'd firmly grasp it. Then I'd take the safety off, and then stick it into my outer thigh for 5 seconds. 1, 2, 3, 4, 5.
Okay.
And then be it.
Well, that's close. You actually want to hold it for double that. You want to hold it for 10 seconds to give the medication plenty of time to get in there. Okay. Okay. So you hang on to the cartridge. Don't discard it. Okay. After you inject it. The doctor at the emergency department will actually want to see this, that you injected it and what it was. And if for some reason one doesn't work, and say you're still having trouble breathing after you inject it, you can use the second one. Okay. All right. So let's just put this back together. Do you want to try for me? Sure. Okay.
So take the safety off, and I'll do it to you since you're the one with the allergy.
Okay.
And then in his outer thigh, so it clicks, and then I'll hold it there for 10 seconds. 1,000, 2,000, 3,000, 4,000, 5,000, 6,000, 7,000, 8,000, 9,000, 10,000, and then I'll take it off.
Okay. Okay, that's okay. Good. Do you guys have any questions about using the EpiPen or the medication that's in it or anything about your allergy?
I just had a question. What did I know if I had any other allergies?
Oh, that's a good question. As we discussed before, we're going to set you up with an appointment with an allergist when you leave the hospital. So that appointment will be next week. We already have it scheduled. I have an appointment card for you. I also have a prescription for a couple of the EpiPens. So the allergist will be able to do further testing. They'll be able to test you for other food allergies or any other allergies that you might have.
Okay.
And so any questions that you have about other allergies or the prescription can be asked at that appointment. And we'll also send all of this information to your primary care physician, so they have a copy of everything as well.
Okay.
So between the allergist and your primary care, they can follow up with you on getting more prescriptions for the EpiPen if you need it, or following up on any other allergies that you might have.
Okay.
Okay. And do you have any other questions about the discharge? Anything else? No? You guys feel comfortable?
Yes.
Do you feel confident in being able to use it?
If I could just get another try at it really quick.
Sure, absolutely. Let's do it one more time.
Okay. So I'd firmly grasp it, take the safety off, and then I'd stick it into my the outer thigh, and then hold it for 10 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000, and then I take it out, and then I bring it to the ER or wherever I go for.
That's perfect.
Medical.
Great job. Thank you guys. Well, you just let me know. I'm going to be around. You guys will be out here shortly, okay?
Okay.
All right.
Thank you.
Thank you.